Okay, most of you guys probably have an opinion on vaccines or have at least heard somebody else's opinion. Today I want to tell you why they are a safe and effective way to prevent an outbreak of deadly diseases. Now, why would we get vaccinated? We have a lot of diseases that have been almost completely eradicated because of vaccines. One of those being diphtheria. It's an infection of the nose and throat. It can cause damage to your heart, kidneys, and even your nervous system. Another one that is protected under the MMR vaccine is measles. Causes a painful rash, sore throat, and fever. Mumps, also under the MMR vaccine, causes swelling of salivary glands, headaches, and fever. Now, some may say that vaccination is kind of like bailing out a boat that has a small leak. You're going to bail it out as hard as you can until it's totally dry, but once it's dry, you're not just going to sit there and relax and let it fill back up again. You have to continually bail it out, just like you have to keep getting vaccines even though a disease might be almost completely eradicated. Now, recently there has been an outbreak of measles, starting mostly in California. There's actually between January 1st and March 20th, 2015, there were 178 cases of measles in 17 states. It is thought to be caused by travelers coming in from other countries and infecting those who are not vaccinated. Now, how do vaccines work? They are mostly considered artificially acquired active immunity, and this means that you're injected with a weakened or dead virus, and your body creates an immune response to that. Now, that's going to create memory cells to that infection. And so the next time that you come in contact with that, you're going to have a rapid response, and it's not going to take you as long to develop those antibodies. It can take 1 to 10 weeks without these memory cells to create antibodies, but if you already have them, you actually skip the primary phase and you go right to the rapid secondary. Sometimes it can be as quick as 24 hours to create a response. Now, vaccines do have some side effects. One that I'm going to talk about is the MMR vaccine. Most of them are going to be very mild, a low-grade fever, which is only 1 in 6 people that get that, or a mild rash, which is 1 in 20. Moderate would be pain and stiffness in your joints. Only 1 in 20 people get that, and it's mostly women. Now, there can be some serious allergic reactions that you can get from vaccines. Now, it's only 1 in 1 million people that have a serious allergic reaction. To give you an idea, you have about the same chances of getting struck by lightning in a year. It's 1 in 1.1 million. Now, recently there's been some more talk about the relation between autism and vaccines. Now, there has been a population-based study in the US and Britain, and also the CDC and American Academy of Pediatrics have done studies and have found no link between the two. Autism is diagnosed between 18 months and 3 years, and the MMR vaccine is given in about the same time frame. So some think that it's just because of the timeline that people kind of connected the two. Now, even though vaccines do have some side effects, they are not nearly as debilitating as the diseases that you can get if you are unvaccinated. Measles, for example, is extremely contagious. You can get it just by being in the same room as someone who has it. Rash, cough, fever are some of the symptoms. More seriously, you can get pneumonia, seizures, brain damage, and even death. Between 2001 and 2013, 28% of children who contracted measles were treated in a hospital. Mumps is another one that you can get. You have fever, muscle pain, the swollen glands that I mentioned before. But you can also get meningitis, which is an infection of the brain and spinal cord, and painful swelling of the testes and ovaries, which can lead to sterility. Now, rubella also causes a rash, arthritis, and a mild fever, but if you contract it while you're pregnant, it can lead to birth defects like this congenital rubella rash and also miscarriage. Now, being unvaccinated really does affect more than just you. 1 child dies every 20 seconds from a vaccine-preventable disease. Being unvaccinated leaves you as a human reservoir, so you can affect and put the elderly at risk who have maybe compromised immune systems, and also infants who are too young to be immunized. Now, medical advancements have created safe and effective vaccines that prevent deadly outbreaks of disease. The mild side effects that may happen because of vaccines are not nearly as debilitating as the diseases they prevent. So please consider, if you have not already been vaccinated or if your children need to be vaccinated, to do it because it affects many more people than just you.